Well, recovery means, to me, it's basically a process of learning to live with my mental health problems, learning to deal with the voices, the shadows on an everyday occurrence. I think Anthony, 1993, describes it very well in his article piece where he says it's living well with the implications of mental illness. And that's what it truly is to me. I'm living the best I can one day at a time with what I have and just learning how to use it, for my own benefit and stuff. So, Ari has helped me tremendously with my recovery. Before I started Ari in August 2015, I was, let's put it this way, I was a loner. I was on my own. I was very socially isolated. My illness had me ruined, pretty much. And I joined Ari then on from my OT, who told me to go and just join it and see how it is. So I went to the involvement centres and I started mingling with people again, and it got me back socialising again and back being confident in socialising again. And then I was put forward to volunteer in the Department of Psychiatry. Now, I used to work in a hospital before I got ill myself. I was a general nursing student, and the last time I was in the hospital, let's put it this way, it didn't go very well. But when I went into DOP and I was greeted and I was accepted for who I was a man with mental illness, and I got to help people, and by helping people through my own experience, it helped me to recover, I think, in my opinion. I think there's a good bit of work needed for mental health services to be completely recovery orientated. From my experience, we need to employ peer support workers, which is starting to happen, I do admit, but we need to employ them, to have someone who is not medicalised focused, but more recovery focused in the DOP and the community setting. We need to change the attitudes of traditional mental health services towards recovery, because at the moment, and I know when I was hospitalised, it was basically the medical model: fix you with tablets, that's it, you have schizophrenia, you're gone, basically, your life is over. And what I've learned through practicing recovery orientated care is that no, just because I have a diagnosis of schizophrenia doesn't mean that I am ruined. So I suppose the change in service attitudes is a massive thing that I think needs to happen in order for us to be recovery focused. But definitely, that can definitely be achieved by employing peer support workers and including consumers in everyday running of centres. So have consumer panels involved, which is starting to happen as well, and just having consumer academics even, so that it's trained for young health professionals starting off. It's trained from the very beginning that there is recovery. It's not just medical, it's more recovery orientated care, and that's what needs to happen, I think, in my opinion.